Hey, it's Dr. John. Today, we're going to take a deep dive into minimizing swelling and bruising on your filler patients. So, with filler, the number one side effect that I run into, with hands down, is going to be swelling and bruising. All right. Nearly everybody gets some degree of swelling or bruising. And I think you can minimize this a lot by not using the needle that comes in the packaging. What do I mean by that? Most fillers will ship a 27 gauge needle with the syringe of filler that you're going to be injecting. Okay, that's not 100% true, but the vast majority of them do. 27 gauge needle is a good needle to push stuff through. Sometimes the filler has to have a good diameter bore to be able to push the filler through because it's a clunkier filler. I'm thinking like the high G prime fillers, right? Whereas some of the finer fillers can get away with a smaller diameter needle. Okay, so let's use that 27 gauge needle as an example. If we're putting a 27 gauge needle into our lips, that's going to cause a lot more trauma. Okay, and the lips swell significantly. So if you're using a product like Revanesse Versa, okay, Versa comes with a 27 gauge needle versus Revanesse Lips comes with a 30 gauge needle. Which one do you think is going to do less trauma? Obviously the 30 gauge needle because it's a smaller diameter. So let's say you don't have any lips on hand, but you want to use some Versa. Well, Versa might be off label for lips, but because it's the identical product between Versa and lips, using Versa in an area like the lips around your mouth is perfectly okay. But I would not use a 27 gauge needle that it comes with. I would backfill that into maybe an insulin syringe that has a 29 gauge needle or a 30 gauge needle and see if that works. That gets me more control over the amount of filler that's coming in. So it's going to be a smaller hole, less trauma, less bruising, and a harder push because now I'm pushing that through a smaller diameter needle. What does that do? It allows me to be more precise with my filler. So if I'm doing something like lips, I want the smallest needle I can get away. When I do a mini lip, which is just a little bit of border work around the vermilion border, I'll put that into a 31 gauge insulin needle and I'll put little tiny dollops all around the area. Or if I'm doing perioral lines, I'll backfill into a 31 gauge needle so I can have really good precision. And I can get that needle just underneath the skin for perioral lines and cause a lot less trauma, a lot less side effects, a lot less bruising as a result. With new people that are getting into injection, I often will see them overfill because they use a bigger needle. They'll push and it just flows out. And when it flows out, it comes up in a clunk. And this might be a reason why you might be seeing bumps or lumps. Another side effect that you can minimize is just changing the needle size. So I like backfilling into other syringes that I have available. I use a variety of different insulin syringes for that, from 29 gauge to 30 gauge to 31 gauge, depending on the product I'm using. If I'm using a high G prime filler, I'm not going to be using that. If I'm going to be putting filler on the bone, I don't worry about swelling or trauma so much. I'll use the needle that comes with the product. I'm thinking things like Radiesse or RHA4 or maybe a Voluma, from Allergan. But if I'm doing fine work, if I'm filling areas that I want to be very precise with, and I don't want to see a lot of trauma, I'm going to a smaller needle. So that's a little tip of the trick today. Switch out the needles on your product and see what difference it makes in your technique.